Grapefruit is a delicious citrus fruit with numerous health benefits. But did you know consuming grapefruit while on certain medications could be harmful? Dr. Shiew-Mei Huang from the Food and Drug Administration, FDA, explains how. According to Dr. Huang, grapefruit juice contains compounds that can inhibit the action of intestinal CYP3A4, an enzyme responsible for breaking down drugs in the body. She further revealed that the longer drugs remain in the body, the greater the risk of liver and kidney failure. In today's video, we'll discuss 8 types of medication you should never take with grapefruit. We'll also provide safer alternatives, so stay with us until the end. 1. Cholesterol medications. If you're on cholesterol-lowering drugs, especially statins like atorvastatin or simvastatin, you might want to avoid grapefruit. This fruit contains compounds called furanocoumarins that inhibit the action of CYP3A4. And if you recall, it's the enzyme responsible for breaking down these medications in your body. When grapefruit inhibits this enzyme, it can cause an increase in the drug's concentration in your bloodstream. This elevated concentration can lead to a higher risk of side effects like muscle pain and liver damage. In extreme cases, it may cause rhabdomyolysis, a serious condition where muscle tissue breaks down and releases harmful proteins into the bloodstream, potentially leading to kidney failure. But that's not all. Findings reveal that grapefruit juice can increase the concentration of some statins by up to 260%, making it crucial to avoid this fruit when taking cholesterol medications. So consider eating oranges or opt for medications like pravastatin and rosuvastatin, which do not interact with grapefruit. 2. Blood pressure medications. Grapefruit can also interfere with blood pressure medications, particularly calcium channel blockers like felodipine and nifedipine. These drugs help relax and widen blood vessels, making it easier for your heart to pump blood. However, grapefruit can increase the levels of these medications in your body, potentially leading to dangerously low blood pressure. Symptoms of low blood pressure include dizziness and fainting, which can be particularly concerning if you're on these medications to manage your heart health. In extreme cases, it can cause inadequate blood flow to the organs, leading to complications such as kidney damage or heart attack. It's essential to be aware of other blood pressure medications that do not interact with grapefruits. Common ones include spironolactone and amlodipine. While grapefruit poses a risk, apples or pears can be delicious alternatives. They provide similar nutritional benefits without the risk of interfering with your medication, allowing you to manage your blood pressure more effectively. 3. Heart rhythm medications. Medications used to manage heart rhythm disorders, such as amiodarone and dronedarone, can also be affected by grapefruit. These drugs help regulate abnormal heartbeats, but when grapefruit interferes, it can lead to excessive levels of the medication in your blood. One study conducted at a clinical investigation center in France administered 300 milliliters of grapefruit juice to 11 men who were taking amiodarone. The results showed that drug levels increased by up to 84% for those who consumed the juice, compared to those who did not. The risk of these side effects includes life-threatening conditions such as torsade de pointes, a specific type of abnormal heart rhythm that requires prompt treatment to prevent fatalities. But that's not all. Elevated drug levels from this interaction can also lead to lung damage, liver damage, and thyroid problems. So, when using these medications, consider opting for apples or pears as a safe and delicious alternative. 4. Anti-infection medications. Certain antibiotics and antifungal medications don't pair well with grapefruit either. For example, erythromycin and some antifungal drugs like ketoconazole can have their effectiveness and safety compromised by grapefruit. The fruit can cause higher concentrations of these drugs in your body, leading to a greater likelihood of experiencing side effects such as liver toxicity, gastrointestinal issues, and even heart problems. Grapefruits can also extend QT intervals when combined with these medications, causing a heart rhythm disorder that leads to serious irregular heartbeats. In severe cases, this can result in sudden cardiac death. When considering alternatives, it's advisable to avoid grapefruit altogether. Clarithromycin, which works similarly to erythromycin, does not interact with grapefruit. Likewise, doxycycline, used for both antibiotic and antimalarial purposes, can also be a suitable alternative. Enjoying the video? Be sure to give it a thumbs up, leave a comment, and subscribe to the channel. 5. Mood medications. If you're taking medications for mood disorders, such as anxiety or depression, grapefruit should be off the menu. Drugs like buspirone and certain SSRIs, selective serotonin reuptake inhibitors, can interact negatively with grapefruit. The fruit can boost the levels of these medications in your blood, increasing the risk of side effects like dizziness, drowsiness, and even serotonin syndrome, a potentially life-threatening condition. For individuals managing their mental health, maintaining a stable medication level is crucial, and grapefruit can disrupt this balance. Symptoms of serotonin syndrome include high fever, seizures, irregular heartbeat, and unconsciousness. This interaction can make managing your mental health condition more challenging, potentially leading to a relapse of symptoms or an increase in medication dosage that could trigger side effects. So instead of grapefruits, consider alternatives like berries and melons, which can benefit your mental health. 6. Blood thinners. Blood thinners such as apixaban and some newer anticoagulants like rivaroxaban are essential for preventing blood clots. However, grapefruit can interfere with these medications, leading to either increased bleeding risk or reduced effectiveness. With warfarin, for example, grapefruit can increase the medication's blood-thinning effects, increasing the risk of bleeding complications. This can result in internal bleeding, which might not be immediately noticeable, but can become life-threatening. Additionally, studies have revealed that grapefruit can reduce the effectiveness of newer anticoagulants, putting you at risk for blood clots. These clots can lead to conditions such as stroke, deep vein thrombosis, or pulmonary embolism, all of which can be fatal if not treated promptly. Consistency is key when managing blood-thinning therapy, and avoiding grapefruit can help you safely maintain that consistency. 7. Pain medications. Some pain medications, particularly opioid analgesics like oxycodone, can also be affected by grapefruit. The fruit can increase the concentration of these drugs in your system, leading to an increased risk of side effects such as respiratory depression, excessive sedation, and even overdose. The effect of grapefruit on the metabolism of pain medications can turn a standard dose into a potentially dangerous one, making it crucial to avoid this fruit if you're on opioid therapy. In cases where it leads to severe respiratory issues, breathing becomes dangerously slow and even stops temporarily. This risk is especially high in individuals who might already be vulnerable, such as the elderly or those with compromised lung function. Therefore, effectively managing pain without risking these side effects involves avoiding grapefruit to maintain stable and safe medication levels. Alternatively, consider using morphine and Dilaudid, as these pain medications are not affected by grapefruit. However, they should be used under medical supervision. 8. Erectile dysfunction, prostate medications. Medications used to treat erectile dysfunction and prostate issues, like sildenafil, Viagra, and tamsulosin, can interact with grapefruit as well. Grapefruit can increase the levels of these drugs in your bloodstream, causing side effects like headaches, flushing, and low blood pressure. For men taking these medications, it's important to avoid grapefruit to ensure the drugs work as intended without causing any harm. The interaction can also lead to severe drops in blood pressure, which might cause fainting or even heart complications, particularly in individuals with pre-existing heart conditions. In the case of medications such as tamsulosin, used for benign prostatic hyperplasia, BPH, increased drug levels can lead to dizziness and orthostatic hypotension. Orthostatic hypotension is a condition where blood pressure drops suddenly upon standing, potentially causing falls and other injuries. Avoiding grapefruit can help manage these conditions safely and effectively, ensuring the benefits of the medication without added risks. Prostate medications like finasteride and dutasteride are safer alternatives as they are not affected by grapefruit. Thank you for watching. Don't forget to like, subscribe, and share your feedback in the comments section below. Be sure to check these videos.